Do you think there's an option out there that's like good that isn't us?
No. I'm dead serious.
Wait.
I know them all
Why?
because they don't work as efficiently. Number one, costs are too high. Number two, they don't have the team. Nobody's assembled a team like this. So you guys may or may not know this, right? I'm telling you, of the thousands I've restored now, and I'm not saying this for any other reason. I've restored 7,000 arches over. Now think about that, 7,000.
You know, have you ever heard like the 10,000 hours to mastery?
Oh, the hours I've probably got 20,000.
Yeah.
So to do that 7,000 patients, oh, maybe 30,000, I don't know how many, 20 years, okay? Every single patient I've ever worked on, those 7,000 arches, I've never had a team like what we have here, ever. It's always been a surgeon doing their own anesthesia and me and some dentist, right? I'm the intermediary. It's always been a periodontist doing their own anesthesia and a dentist, and I'm the intermediary. I'm the lab. I've seen people have dentists doing the surgery, the anesthesia, and working with us as a lab, okay? I've never had, ever, at Clear, it's surgeon doing the anesthesia with a prosthodontist in the lab, okay? But it's missing the anesthesia part. New is gonna be surgeon or dentist doing their own anesthesia, maybe sometimes having an anesthesiologist, but probably doing their own anesthesia, working with an in-house lab, okay, who's a dentist, okay? I don't think they have prosthodontists. Maybe they do, but I don't think so. So you see the combo here. There's not, I'm just telling you, there's nothing out there that I know of on a scalable level. What I'm telling you is nothing exists like what we're doing, where you literally have the surgeon, the anesthesiologist, the prosthodontist in a vertically integrated workflow that is tied to a lab process to kick. That doesn't exist in the whole market. Nobody's doing it, I'm telling you, except for us. And guess what? We're doing it at the best price out there. So why are you going to pay 25 grand, 30 grand for a crap team? It makes no sense. That's what I'm saying. So you guys may not know all this stuff. Like you know what I'm saying? Like
It's like spending the most money on like a double A player.
it's like spending. It's like going out and hey, I'm spending a ton of money for Volkswagens, and all of a sudden this guy's coming with a Mercedes Benz and he's selling it to me for half the cost. What? Who's going to buy a Volkswagen? That's exactly like what we're doing. Does that make sense?
It's kind of crazy.
So I just want you guys to know like that how unique this is. It's unique.
It's why we do it.
It's totally disruptive, and so
How come no one's been able to do it before?
I don't think people have. Well, okay, I'm not gonna be humble here.
Good.
Here's why. Here's honestly why. Because they haven't been able to, even if they wanted to. Number one, if you don't have a process, you can't build around it. So the process is, if you look at how every process, and what do I mean by that? The process of taking someone from where they are to where they want to be. Okay, getting that smile. Okay, you have to go through steps. Well, there's a million ways to skin a cat. If you don't have a standard, the ways we've been doing it for the last 40 years, there's no standard. Everybody has their own little thing. So how do you create a process around that? You can't. How do you train to that? You can't.
Is there like a full arch school?
No.
No.
No, there isn't.
So it's self-taught every single time.
This isn't like I say, entrepreneurs do two things. They make things better and they solve problems. This was a problem. And I remember sitting when I came, I came, that's my own thinking, right? Like I knew that 10 years ago, and I sat there and went, here's a problem. Okay, how do we solve it? And for whatever reason, I got bit by the bug to solve this problem. And I've been obsessed with it. It's like, I don't want to be obsessed with it because it's a headache, but I'm obsessed with it, right? So, no kidding. And I've been at the front lines, like, how do we do this? Well, I can tell you, nobody knows. And I mean that, that's a bold statement. Dental implant companies aren't going to solve it. They don't have the ability. Surgeons aren't going to. It's not, the solution is not going to come from the surgeon profession. General dentists aren't going to solve it. Labs aren't going to solve it, no matter how sophisticated, how big, they're not going to solve it. They don't have the ability. It has to come from the honestly, it has to come from our thinking, our philosophy, to go in and dissect what the heck's going on and say, this is how it has to be. And I think that's honestly what I've done. So I just had one piece to this, okay? I feel when you ask that question, no, there isn't. I can promise you.
There isn't what?
A better process than how we're doing it.
Yeah.
I really believe that. That's actually standardized. People go out and teach and say, well, this is how I do it. And if I run into this situation, this is what I do. And if I do this, this is what I do. And I have a good technician that does all that. No, like that's not standard. An actual process. Chick-fil-A, okay? It's Toyota, Apple, anybody that makes anybody that manufactures a product, they have the desired outcome that they want with all the characteristics. Okay, how do I do that every single time with no variability? Repeatable results, no variability, and to do it the most efficient, cost-effective way possible. That's the general workflow for anybody that makes a product. Well, we make a product. Our product's a smile outcome. So how do I make that smile every time for as little cost as possible, with as minimal skill as possible, and minimal variability as possible? How do I do that? Okay, well, if you don't have a process, you can't do it. So why has nobody been able to do it? Because there's no process.
So why aren't you charging like double for this?
We could. Shoot, good idea. Let's call.
Why aren't we doing that?
No, I would say because we know. I mean, honestly, like this, we're not doing it because there's so many people that need it, and we don't have to. And I guess we're good guys. I don't know, but really, to change the market, costs have to come down. Costs only come down when technology and processes are more efficient.